I am Ryan, the Life Changer, and I am so grateful that you decided to join me today. This podcast is called Unlock the Power of Your Mind. Let me ask you a question. Are you ready for your life to change? Are you ready to unlock the power of your mind? Are you ready to be the best version of you possible? I want to help you. I want this podcast to give new, positive meanings to the difficult times that you faced in your life. And I want to help you become the best version of you possible. This is your time. The change is happening for you now. I know you're ready. Let's help today to change your life. All right, ladies and gentlemen, thank you so very much for your time today. I'm super excited for the topic that we're going to be discussing today. I have with me Dr. Stacie Locascio. She is a chiropractor and also certified in neurofeedback. This is some cutting edge technology, and I'm very excited for the opportunity to speak with Dr. Stacie today, and ladies and gentlemen of the audience, for you to really hear about something that has made a positive impact in Dr. Stacie's life and in mine. So Dr. Stacie, thank you so much for your time today. How are you?
I'm wonderful. Thank you. Thank you for having me.
Absolutely. So I always like to start off so that the listeners can feel a little bit more connected with the guest. Dr. Stacie, tell us a little bit about yourself and maybe kind of your early childhood and how you got into the field of being a medical professional.
Well, it's funny you should say my early childhood. How I got into neurofeedback is actually because I was born with asymmetrical facet joints, which caused me to have a weak disc at L5S1, which eventually led to me having fusion surgery, which means I was no longer able to practice chiropractic.
Wow.
But in my continuing ed, I discovered neurofeedback, and I said, okay, this is a way I can still put my brain to use and serve people, even though I can't adjust.
Sure. And so for the listeners that maybe aren't familiar, going to chiropractic school, how long is that? You've got your undergrad for 4 years and then school.
And then it's 10 trimesters, which they do, some do in 3.5 years, some others it takes a little bit longer. We're almost 3.5 years. It's 10 semesters, 22 to 29 credits per semester for the first, I think 7, and then 8, 9, and 10, you're still taking classes, but you're doing an internship. So it's no longer that 22 to 29 credit load that was happening 3 times a year for the past couple of years.
Wow. So we'll certainly get into neurofeedback, but I think I want to pause there for a second. This podcast is designed to help people unlock the power of their mind and to overcome adversity. It sounds like in your professional career there, you kind of had a little bit of a roadblock and you were able to pivot. Share with the listeners what that was like when you were no longer able to, in that specific capacity as a chiropractor, continue to help people because of the physical limitation. How did you deal with that mentally and emotionally?
It wasn't easy. It wasn't easy because I had gone into something else and I was planning to come back to chiropractic. And that was my goal, my plan. And I had to pivot off the plan. As you said, exactly. I had to make a turn and do like at least a 90-degree turn, if not a 180. And also being physically, disabled, so to speak, or differently abled at this point was something that I had to go down under and come through. Do you know what I mean?
Yeah, for sure.
But with discovering neurofeedback, I actually discovered it while I was doing my continuing education for chiropractic, which everybody has to do. Every profession has their CE, the credits that they have to do. So in doing that, I was thankfully guided by some unseen hand towards the continuing education that is one part of what the founder of this neurofeedback system, this Braincore neurofeedback system, does. And he talked about it a little bit in his continuing ed, and I decided to investigate it, and I got very excited when I saw the history of it and what it can do for people. And I followed up on it, and I've done it on myself. which I don't know if you want to get into here or later.
Yeah,
But
absolutely. Sure. We'll get into that. I think that two things you said there. Number one, differently abled. I love that. That I think really resonates, such a positive message for people who are told that, maybe they're different or they learn different or whatever the case may be. So I think that's incredible. And then the other thing is I say to people all the time, it's easy to connect the dots when we're looking back, but sometimes it becomes very difficult to connect the dots when we're looking forward. Now, looking back, you were able to see, that part of this continuing education through the chiropractor led you to the neurofeedback, and that's so beautiful, isn't it?
yes, it absolutely is. Absolutely is. I'm a believer. One door closes, another one opens. If for everything that you can't do, there's something that you can do.
Awesome. So now that the listeners kind of have an idea on how it was that you got into neurofeedback, explain to the listeners what neurofeedback is, because I'll be honest, if you asked me that question 3 months ago, Dr. Stacie, I would have said I had no idea. In layman's terms or simplistic terms, what is neurofeedback?
Neurofeedback is a non-invasive, meaning that they don't go through your skin. There's no x-rays, there's no needles in your scalp, there's nothing like that. It's totally non-invasive way to train your brain. There are sensors that are pasted onto your scalp that are going to be removed at the end of the session. It's about a half an hour session. They're going to be removed at the end of the session, and you're going to walk out exactly the same way you came in, except that these sensors and the reading of your brain waves enables your brain to see how it's functioning, much as you see that you have lipstick on your teeth or that your hair is out of place when you pass by a mirror. But unless you pass by that mirror, you don't know about those things. It enables your brain to see where it's creating too much of one thing, not enough of another in terms of brain waves, the alpha brain waves or beta brain waves. And that allows your brain to make corrections, and it also feeds back the corrections in real time to your brain. So it's essentially like holding up a mirror to your brain to show it what it's doing wrong and right at a particular place.
Sure. Okay. That makes sense. Holding a mirror to your brain.
Yeah.
That sounds like I'm familiar with neurofeedback now, but for the listeners, I think that kind of helps to paint the picture. Imagine you're looking at your brain in real time. So you said that if there's too much in one area, what happens in the brain if we've got too much, what is it, overstimulation in a certain area, or what does that mean?
The brain waves are thrown off when a number of neurons fire. And if they're firing too rapidly, you're going to get too much beta. And if you have too much beta, that's like an overstimulation. That's you can become anxious. You can start worrying about things. You can have things like OCD. Those are products of too much beta or of a wrong symmetry of beta. Too much beta on one side, not enough on the other. If your brain puts out too much alpha, then you can have things like depression and all of the things that go with depression. And then there's a whole different set of brain waves that can give a picture of if somebody has attention deficit disorder, which involves cognition and delta theta and alpha and beta. It involves all four areas.
Got it.
Become easily bored. And that's a product of, your brain firing too much.
Understood. I would be somebody that has the overwhelming of the beta sometimes, and we can get into a little bit of my experience. But I'd love to hear for yourself, Dr. Stacie, share with the listeners, when you're going through this continuing education, because the listeners, they may be able to relate with you, they may be able to relate with me, or maybe they'll be able to relate with the anecdote of one of your patients. Whatever it is, I hope that they're able to connect to it and at least research more on neurofeedback. So how has neurofeedback helped you, Dr. Stacie?
it's helped me. I have ADD, and ADD people are very impulsive. They don't always listen to the entire story before responding. And I have two kids, they're 27 and 25. When I first started doing this, they were about, I think, 24 and 22. And my relationship with them reflected that I was impulsive and that I, wouldn't necessarily listen to what they had to say and sometimes flew off the handle with them, in that they were, I don't know what word I want to be, hesitant, I guess, with me in certain, or they were always ready to respond to me like I was responding to them. And it was played havoc with the relationship a little bit. And as soon as I started doing this, I was able to take that step back and listen and understand what they were saying to me before I responded, which is tremendous for any attention deficit person. Anybody out there who has attention deficit disorder can relate to this in any of their relationships, including probably their job, which plays havoc with your whole life.
For sure.
And the relationship has changed tremendously between myself and my kids. It really has. That's one area that it's been worth every second, every penny. It's been worth everything just for that.
Of course, yeah, the relationship with our loved ones. If there's a way that we can improve our relationship with the people closest to us, most people would probably pay or do anything for that, right?
I would assume so, yeah.
With most family members, maybe.
Correct.
Okay, and so, for you, Dr. Stacie, was this something that you noticed like an immediate difference after one session? Did it take you a week? Was it prolonged and gradual over time?
I noticed it. I started to notice it after one session. I don't think they started to notice it until a few weeks in.
And how many sessions were you doing a week?
I was doing 2 sessions a week.
Would you say that that's the recommended amount?
Yes, it can be done quicker. You can do more sessions, especially if you have to do it remotely, because you're paying by the month for the equipment if you're doing it remotely. But yes, definitely two sessions a week for people who are doing it, in town. That's the optimal.
Sure. Okay. And so share anecdotally, it doesn't have to be any specific names or specific situations, but maybe one of the patients that came to you and said, Dr. Stacie, thank you so much. You changed my life through the neurofeedback. What was kind of the backstory of that individual? Maybe somebody where it was a little bit of a different catalyst for them to start than for you or for somebody with anxiety like me.
I had one woman who she's a friend, and I asked her to please come and do this to help me get started. This was right in the beginning, to please come and do this to help me get started. I knew she had issues here or there, but I didn't know until the very end the extent of her issues, because at the end, after she was done with this and her job was going much better and her life in general was going much better, she came and she said to me, "You have no idea that you literally pulled me back from the edge. I was ready to jump."
Wow.
Yep. Didn't know it at the time until later when she said that to me, and I'm all goosebumpy thinking about it.
Sure.
That I could have lost a friend but for this, intervention.
Yeah.
And another one, a young kid. This was one of my more profound transformations, and it also makes me tear up sometimes when I talk about it. Is he was a 15-year-old, and at 15 years old, he still had certain rituals that he had to have, and if he couldn't have them, he couldn't go to sleep, and they involved parents at sleep time, and a lot of yelling and discord and things like that going on in the house, because he became obsessed with things and he couldn't let things go. And all this discord in the house finally led them to come to me. And now I have written testimonial from them that for the first time in his 15 years, he has a group of friends that he hangs out with. He's able to go to sleep on his own at 15 years old for the first time in his life.
Well, it's sad because, of course, we know that wouldn't be normal for a 15-year-old to be at that point. But wow, how amazing did you feel to hear that feedback that you changed that individual's life?
Absolutely incredible.
Uh,
One of those keeps you going stories.
Yeah, oh, for sure, for sure. And how long into during neurofeedback did you have that transformation with that individual?
That was about 2 years in.
Wow. Okay. So you had the one right in the beginning, as if the anecdotal evidence on yourself wasn't enough. Then you got the extra motivation in the beginning from your friend, and then here you are. And I'm sure you had many success stories along the way as well. But then you've got this other one now. Incredible.
Those stand out.
And so for yourself, is this something, are we allowed to continue to do neurofeedback? Should it only be done for a period of time until the symptoms go away? What's the science there?
You can do it for a period of time until the symptoms go away, and then there are other sort of single sensor. Most of the protocols are dual sensor. So there's one on the right, one on the left, and then there's a protocol that's single sensor that you can do to help resolve any old traumas that might still be informing your behavior or your thoughts. And that can be done, it can be done after the protocol stop. You can start doing it twice a week until you start feeling like, wow, I can think about that thing now, and it doesn't feel the same as it did. It doesn't have any power or sway anymore. And then you can do that periodically. Come in once a month if you like it for deep, like a deep meditation kind of thing. Or
Okay.
however often you like. There's not a point at which that particular protocol, that deep meditation protocol, becomes something that's not worthwhile.
Sure, that makes sense. Meditation is always going to be beneficial. I guess the reason that I ask is because when we're talking about these brain waves and holding the mirror to the brain, is part of what neurofeedback does helping the brain to kind of systematically start rewiring and firing the way that the neurons should?
Now I understand the question. Yes, it's training, and like most trainings, you fall back on it, you rely on it. This is why we do 20 sessions and don't say, okay, you're trained. You do 20 sessions until it's ingrained, and that's the way your brain operates. And that should be permanent. Now, if there's any sort of trauma or illness that can throw things off in between, you might want to come in for just to check and make sure things are still okay. But other than that, it should be permanent.
Awesome. And I think that's what's so powerful about this is it's not like this is something that you're going to have to do for the rest of your life. There may be different point in times in your life where you may want to utilize the technology. But what I really love is how it helps naturally in a holistic, non-invasive way to kind of get the brain, I'm going to go very non-scientific here, but kind of get the brain waves back on track. Would you say that that's a layman's definition?
That's exactly what it does.
And so I've shared a few pictures on my social media of seeing yourself all hooked up with the the patches on your head. But explain to the listeners what the setup of the technology is like for neurofeedback.
Okay, well, first there's the EEG, which is the funny red hat with the white plastic discs in it, and it's got this rainbow colored wire coming out of it. That's just for the exams. And that you have to wear for about a half an hour, enough to get 6 1-minute readings from different areas with your eyes closed, and then the same 6 1-minute readings from 6 different areas with your eyes open. That's for the exam. Then for the regular treatments, there are little flat metal clips that go on your ears. It's like 2 plates on either side, and they're clipped onto your earlobes, 2 on one side and 1 on the other. And then there are 2 sort of curved, like kind of teeny tiny half-inch bowl-shaped sensors that get some paste in them, and those are put onto various areas on your head. It could be on the frontal, right and left frontal. It could be on the right and left, on the occiput on the back of your head, any one of a few different areas on your head, and you'll sit with those pasted there for a half an hour. And should I explain what the procedure, what the sessions feel like now?
Yes, absolutely, please.
Okay. While you have those pasted on your head, you're going to tell me what you like to watch on Netflix or on Hulu, something like that. Or I even have people going into various anime, like there's a word I'm looking for, but I can't find it now. It was sort of
like cartoons.
Right, exactly. But stuff that not everybody would know about. So we find what they want to watch, and we put it on for half an hour with headphones. And as they're watching, the sensors are reading their brain waves and feeding it back to them in real time. Now, the feedback is through their eyes and through their ears. So they're watching and they're listening. As the brain waves deviate from where we want to take them, the volume drops and the brightness drops. So it's harder to see and hear. And your brain says, okay, let me scan for a way that I can watch this, that I can see this and hear this, because I know I can see it and hear it. I just have to find the way to do it. And as it does, the picture gets brighter and louder. And if it goes off again, the volume drops and the brightness drops, and it goes on back and forth like that for a half an hour. And as you go through the sessions more and more, you can see it more and hear it more. And that's how you know your brain's getting trained. And that's how we know. I mean, I'm actually watching, the activity of what's going on, but you're watching the TV and seeing it get brighter and dark, and the volume get higher and lower. And that's how you know what's going on. And I know what's going on through seeing your brain waves. And as we go through, your brain waves they first side to side, they come together, and then they sort of all come together. And that's how we know that we're on the right track and moving forward.
Awesome. So for the listeners, it's almost kind of like that as if the brain started to misfire, the picture is going to get blurry, and that's going to let us know, hey, brain's not firing the way it needs to fire. Let's have the brain recorrect itself, and then the picture will come clear again.
Exactly. It's harder to see.
Sure. Okay, cool. So I'll dive in and share with the listeners a little bit about what my experience was. I was in a car accident. I was hit from behind when I was parked or stopped at a red light. And for anybody that's ever been into a car accident before where they were hit from behind, they can relate with the anxiety that you feel, or anybody that's been into a car accident, but particularly when it's not your fault. That anxiety that you feel. And so for me, it was getting to the point where if I was driving on a highway or really any road, but particularly when I was at a higher rate of speed, if I start to see anybody that I thought was going to start to come into my lane, I would get a large amount of anxiety. I wouldn't really say flashbacks. I would get flashbacks sometimes if I was parked at a light, but it was more so driving on the highways where I would feel like somebody was starting to get dangerously close to me. Did you ever have anybody that came to you that was in a car accident, Dr. Stacie?
Yes, but more for concussion than anxiety. But I'm sure plenty of my anxiety patients have been in car accidents, but that wasn't necessarily the triggering trauma as they recalled it.
Sure. For me, it was. I mean, I've always kind of had some anxiety. I would exercise, and that, of course, was one way to really help me out. But it was getting to the point where I couldn't exercise the way I used to because I have four herniated discs and pinched nerves and all this other stuff. So I was losing. Maybe the listeners can relate with this if they suffered in an accident or if they are unable to do the healthy outlets that they used to do, that were de-stressors. I want to highly encourage everybody to really consider doing neurofeedback, because for me, it was a tremendous way to alleviate my anxiety.
That's great.
And so, the first time that prior to the accident, I will be fully transparent, I had no idea what neurofeedback was. I feel so blessed and so grateful that I was able to uncover it. And that, of course, is what prompted me to reach out to you as an expert in the field. But the first time I go in there, they put the electrodes on my head, and they're for me, it was playing music. And I'm like, all right, this is kind of cool. I had them shut off the lights, and it just felt good to be in peace for 30 minutes. But I didn't walk away at that present moment when I walked out of the office. I didn't feel any different, maybe a little bit more relaxed. But Dr. Stacie, I tell you, I got into my car. I had to go up onto the highway. My anxiety felt so much better after just that first session. It was incredible.
It's really, really tremendous technology. And I feel blessed to be able to be on this podcast with you, putting that out there to hopefully more people, whether they come to me or they go to anybody else, because any neurofeedback should be good neurofeedback.
Yeah, for sure. So I don't know if I'm the anomaly, but literally after the first session, and I don't want to say a skeptic, but I like to consider myself pretty well educated, at least on my body and how my body reacts to things and what works for me and what doesn't. But after that first session, I was hooked, and it wasn't like it cured it perfectly, but it has certainly, I've noticed the benefit has gotten greater and greater as time has gone on. So is that kind of the feedback that you've gotten from the other individuals as well? They notice as more treatment goes on, they feel better and better?
Well, the treatment itself is relaxing, so people generally feel relaxed after the treatments, but they don't always come back to me and say, the thing that I came to you for actually changed, or I actually felt any relief from that initially. That can take some time, but the treatments themselves are relaxing. So you were fortunate.
Okay.
That you felt that drop in your anxiety right away.
All right. Well, I feel blessed to hear you say that. I want to share with the listeners one last quote from you, and then we'll dive into how it is that they can get in touch with you. And if you're in the tri-state area, I would highly encourage you to go see Dr. Stacie. But you said something when you and I were communicating prior to the podcast. You said, I don't treat a diagnosis, I treat brainwaves. And I respect you so much for that statement. I think it's so powerful. Share with the listeners what you mean by that statement.
Okay, so what I mean is somebody can come to me and say, my child's been diagnosed with ADHD. Wonderful. Somebody else can come to me and say, my child has all of these symptoms that are all in line with what I would consider to be ADHD, but the child's never been diagnosed. That's fine too. Come on in. If your brain waves show that you have X, Y, and Z that are a typical ADHD picture, that's fine. We'll treat those brainwaves. If the brainwaves show that it's a different picture, I'll treat that picture. I'm treating your brainwaves. You can tell me you're anxious. You can tell me you've been diagnosed with anxiety. You can tell me your doctor said it's this. Your doctor said it's not that. Whatever they said, it doesn't matter. I'm going to treat what I find on that EEG exam. That's what we're working on. And your symptoms, you're going to have a subjective checklist of symptoms that you're going to tell me each week how they are without looking at the numbers you gave me the week before. And it's going to show in a graph over the 10 weeks how the symptoms have improved. And those are going to be symptoms that you choose, that of your choosing, how you feel about your anxiety level or your reading comprehension or your inability to sleep or whatever it is.
Do you have people come to you, Dr. Stacie? The diagnosis, I just think, is and I'm not sure if your thoughts are the same as mine here, but I'll express them for the listeners so that we can create some conversation on the topic. I think so many times in the world that we live in today, people will come to me, for instance, and say, I am a type 2 diabetic, or, I am someone with high blood pressure. And I always, encourage them, like, you are not your diagnosis. You are a human being, and your body has maybe developed this as a way to keep you alive, but you are not your diagnosis. Do you feel like you have people come to you, or maybe they feel just depressed or overly depressed? And when I say depressed, I mean because they feel like they've been labeled with a diagnosis. Do you have individuals that come to you like that, Dr. Stacie?
Sure. And it's handicapping in a way that you feel like this is what I am, and there's not much I can do about it. Like I did in the very beginning. I'm labeled disabled. I don't consider myself disabled. I consider myself differently abled. I mean, obviously with diabetes, you have to take care of your blood sugar. I'm not disregarding that, but in particular, and things like high blood pressure. But in specific with those two, you are not your diagnosis. If you consider yourself a diabetic with high blood pressure, you're going to feel like awful about yourself, and it's going to be a demotivator. Whereas if you say, look at these things as a challenge, in particular those two, and you get on your diet and your exercise, and you start living healthier and eating less inflammatory stuff, you're going to be healthier.
Sure. Yeah, I'm with you, and that's why when you said that, I said, wow, that's so powerful. It's a message that I really try and relay. So I'm in alignment, and I respect you so much for that. So now the listeners, hopefully at this point, between what you've shared and what I've shared, and those stories of the two individuals, your friend and that young boy, hopefully the listeners at this point want to learn more, or maybe they even want to come see you. How can the listeners get in touch with you, Dr. Stacie?
Well, I can be reached on Facebook at Dr. Stacie Locascio. I can be reached on Instagram at Dr._Stacie_Neurofeedback, and my name is spelled with an IE. I'm still looking for the blessing in that, but that's what it is.
You'll be easier to find on social media. That's the advantage.
Right. Right. My phone number is 516-903-4599. That's my direct line. I answer all my own phone calls. And by email at s.locascio, that's LOCAS like Sam, C again, IO, at optonline.net, opeterthomasonline.net.
Awesome. And you're located in New York. For those that aren't familiar with the 516 area code, if it's somebody local to you and I, what town are you in, or what other towns surround you?
I'm in Locust Valley, which is right near Glen Cove, near Bayville, near Greenvale, Roslyn. All of those areas are in my territory, so to speak.
Understood. Awesome. Well, sure. Dr. State, yeah, go ahead.
It's on the North Shore.
North Shore, Long Island.
Yes.
Awesome. Dr. Stacie, thank you so very much for your time today. I really hope that after what you and I have shared here today, people are going to go check you out, learn more about neurofeedback. If there's somebody that's, not close to where you and I are, hopefully they can find a local practitioner. But if they're in the area, I'm going to highly recommend that you go see Dr. Stacie. So thank you so very much for your time today. I appreciate it.
Thank you, Ryan. Thanks for having me on. I can't tell you how much it means. I really appreciate it.
Awesome. Well, any opportunity that I have where we can share information and change lives together, that is my purpose, and I'm sure that it is yours as well. So hopefully we were able to change some lives today.
Thanks.
All the best. Bye-bye. Ladies and gentlemen, I just want to say from the bottom of my heart, thank you so much for taking the time to listen to this podcast today. My prayer is that it has helped to change your life, to make a positive impact in your life. And I just want to let you know that every single day, the first goal that I write down is I have changed 1 million lives. So ladies and gentlemen, if this podcast helped to change your life today, I would ask you to please go on to iTunes, rate, review, and share this episode with somebody else who you know will benefit and have their life changed. Thank you again so very much. It means the world to me. Go out there and be great today. Make a positive impact in the world.